Lung cancer is the third most common cancer in the United States. And the good news is early detection can decrease the chance of death by up to 20% among high-risk populations. Joining me now, Dr. Jenifer Marks, a thoracic surgeon with HealthONE. We appreciate your time today.
Thank you. Good morning.
All right, let's start off. What kind of early screenings do you recommend when it comes to this?
So for patients who have a significant smoking history, once they hit the age of 50, they're eligible for a low-dose CAT scan, which is what is the most effective way to reduce the mortality of lung cancer, as well as find it early when we have many more treatment options.
So who's considered high risk for this?
Those patients who have smoked at least a pack a day for 20 years, which is what we call a 20-pack year history. Those are the patients who are, once they reach the age of 50, eligible for screening, which is covered by all major insurances.
And just to be clear, you don't need to be a smoker to get this, right?
Correct. Even if you smoked, and quit 10, 20 years ago, but you still have that pack history, you would still be eligible to be screened.
As far as treatment, how has it evolved over the years?
Treatment has changed dramatically in the last, I would say, 5 to 6 years, but also more recently in the last year or two. Surgery is still the gold standard for cancers that are diagnosed early. Unfortunately, most cancers are diagnosed late when surgery is not an option, and patients have to receive either systemic chemotherapy, newer options like immunotherapy or targeted therapy, as well as radiation. But if we can find it early by screening patients, surgery is potentially curative. So that's why we like to try to push patients to go get screened if they have those risk factors.
Better be safe than sorry, right? We touched on smoking. What are some other main causes when it comes to lung cancer?
We have higher levels of radon here in Colorado, and so radon is a known risk factor. We encourage anyone with a basement, or if they've seen people in the neighborhood with radon mitigation symptoms, to have your basement checked out. And family history of lung cancer does increase your risk slightly. However, it's nowhere near that of if you were an active smoker itself. Those are the main ones that we know are factors causing most lung cancers.
You know, one of the big stories we've been covering in the media the last few years is the rise in teen vaping. What's your message to teens who might see this, want to try it out, or who are currently doing it?
I would say we don't yet know all of the risks possibly associated with that, but certainly inhaling any chemicals into your lungs is unhealthy for them. And I think it's going to be 10, 20 years down the road before we fully understand all the risks of vaping, as well as, with the legalization of marijuana, that as well.
All right. Dr. Marks, thanks so much for your time. We really appreciate it.
Thank you very much.
All right. Don't forget, you can always find all of our health interviews right now on cbscolorado.com.